If you're planning to move to the UK for a nursing role, you will need to sit the Objective Structured Clinical Examination or OSCE. It's a competency test that is part of the Nursing and Midwifery Council's registration process for nurses and midwives trained outside the EU or EEA. This means that you must show that you are capable of applying knowledge to the care of patients at the level expected of a newly registered nurse. You will be required to act out scenarios that nurses and midwives are likely to experience when assessing, planning, delivering, and evaluating care in the UK. Here are 7 crucial tips and strategies to prepare for your OSCE. Strategy number 1. Set your mind that the OSCE is like a real-life clinical situation. Treat each stations as if you are in an actual practice. One way to make the fear or anxiety go away is to simply think of the OSCE as a placement or return demonstration of a clinical skill. Tip 1. Whatever station you are going to do, make sure to structure your patient approach. Memorize your opening pattern until it becomes second nature. This should consist of greeting the patient, introducing yourself, checking their identity, describing the procedure, examination, and gaining their permission to continue. You will be given approximately 5 minutes to read the patient profile or history. Make sure the scene is safe. Hand wash before approaching the patient. Talk through the procedure. Introduce yourself to the patient and confirm their identity by asking their name and/or date of birth. Introduce yourself to the patient. Explain why you are here and what clinical skill you are going to perform. And most importantly, do gain consent. Strategy number 2. Mentally check off the NHS 6C before the start of any assessment. By mentally checking these, you are demonstrating to the examiner that you have a firm grasp of the way nursing is performed. Tip 2. Speak your skill. OSCE are not meant to be done silently. The more you verbally express your thoughts, the better. You need to tell the examiner what you are doing and why you are doing it. Speak your thought bubbles. Make your thoughts clear and heard. Strategy 3. Make inanimate objects alive. When moving or touching objects or equipment during OSCE, give the objects voice. Verbally express that you have calibrated and cleaned the observation machine. You are moving the glass or table to a safer place, etc. This makes sure that the examiner won't miss anything you do. Tip 3. Present yourself well. Like inanimate objects that needs to have a voice, your uniform needs your voice. Nothing is worse than a disarrayed, dirty, or creased uniform. OSCE is a formal assessment, and you should be presenting yourself to the examiner as if you were presenting yourself in front of a patient. Your uniform needs to be clean. It needs to be ironed. You need to have your name badge on you. If you've got your lanyard with your identification badge, please wear that and look your absolute best. Strategy 4. Familiarize yourself with the equipment list and glossary of terms. The equipments that will be used and available during OSCE are often identified and common to all OSCE test center. Knowing the use of each equipment will help alleviate any of your fears or nervous during OSCE. Read and familiarize yourself with the glossary of technical terms used. Do not memorize, but learn and understand them. Tip 4. Read, and read the OSCE documentation at least 2 to 3 times daily before your OSCE and during the preparation weeks before your exam date. Reading frequently makes you familiar with them and takes the unfamiliarity away. Strategy 5. Read and understand the various supporting documents or resource materials available to you. There are lots of additional support material which you will need to be familiarized with as these are used during the OSCE. Do not cram. Learn and understand how these supporting documents play a role during the exam. Tip 5. Try to answer and fill in documents and forms used in the exam during your review period. Remember to verbalize your mind and your reasoning for doing so. Think aloud. Strategy 6. Practice makes perfect. Grab a friend and practice regularly until your examinations are fluent and confident. Exam nervousness can affect your performance, so it's better to be a bit overprepared than under. If your employer allows you to practice with their equipment, then take advantage of those opportunities. Remember to practice with a timer too, as the minutes fly by in the real thing. Tip 6. Try practicing various skills station at least 2 to 3 times a day. This will make the skill second nature, and you can rectify any mistakes early. Remember to speak your mind when doing some actions. Strategy 7. Read the information about the station carefully. Do not rush. Understand what is being asked or instructed. Read the instructions carefully before you enter the station. It sounds silly, but people have been known to do the wrong examination in OSCE. For example, assessing the upper limb instead of lower limb neurological examination. If you don't do what you've been asked, you just won't get the marks. And finally, tip 7. Tap your own body part to tactile remind you of what is being asked in the skill information. It will help to tactile remind yourself about what is being asked or instructed.